Olá, boa tarde a todos e a todas. Chegamos, então, na última conferência de encerramento do nosso primeiro Simples de 2020. Ela vai ser proferida pela professora Jolanda Jetten e eu vou apresentá-la a vocês. A professora Jolanda Jetten possui graduação em Psicologia pela Radboud University e doutorado pela Universidade de Amsterdã. Realizou pós-doutorado na Universidade de Queensland, na Austrália. Foi professora da Universidade de Exeter, no Reino Unido, e atualmente é professora de Psicologia Social da Universidade de Queensland, na Austrália. Dentre vários prêmios, é uma lista longa, ela conseguiu na sua carreira. Jolanda ganhou, em 2004, a medalha Spearman, da British Psychological Society, e, em 2014, a medalha Kurt Lewin, da Associação Europeia de Psicologia Social. Em 2018, foi premiada com uma Australian Laureate Fellowship, além de, em 2017, ter sido referida no livro Quem são as Mulheres Australianas. É editora de vários periódicos no campo da psicologia social e foi coeditora-chefe do British Journal of Social Psychology, do Social Issues, e até 2018 era autora, até 2018, o currículo está atualizado aqui para mim em 2018, ela foi autora ou coautora de 8 livros, 36 capítulos e 159 artigos científicos. Na conferência de hoje, a professora Jolanda Jetten abordará, de forma gravada, vista a diferença de fuso horário da Austrália para o Brasil ser impeditiva de aparecermos de forma síncrona, ela vai abordar partes do seu livro, o último livro publicado em 2020, que se intitula Together, a parte de Psychology of COVID-19. Nós temos esse livro disponível para as pessoas, depois a gente vai colocar o link no chat para vocês terem acesso, o livro tem acesso aberto. A tradução e colocação de legendas para o português na conferência que em seguida iniciaremos, só foi possível graças ao excelente trabalho de Josiane Ferreira, Camila Aires e Lorena Leite, a quem agradecemos muito. Bem, vamos iniciar então a videoconferência da professora Jolanda Jetten. Eu aproveito para lembrar-lhes mais uma vez que é uma comunicação gravada. Ao final, registraremos e encaminharemos suas perguntas e comentários à professora. Obrigado pela atenção e interesse e boa conferência a todos. Laís, obrigado.
Let me start by thanking you, Marcus and Dalila, for asking me to actually present to this group. It's a great honor to be able to join you, even if it is from a distance and in another country. It would have been so much better to see you in person. What I would like to do is to talk a little bit about one of the themes that is central to a book that we recently did on COVID. It's called Together Apart, The Psychology of COVID-19. And what I would like to focus on is on how COVID has affected our well-being. But before doing that, I would like to give a bit of an overview of the research that we've done for years now in this area. So it may take a little while before I actually come to COVID, but I think it's important to give you a little bit of background. So, right, what I would like to do is to start with a very simple exercise. What I would like you to do is to look at all of these factors that we know are important predictors of mortality, of early death for people. So you can see things that you probably know are quite bad for your health: not smoking, not being obese, if you have social support, exercise, etc. So what I would like you to do is to take a minute and to think about the 3 most important factors that will prevent early mortality. Yeah, so which are the 3 factors here, the type of behavior you should engage in if you want to live a long life? All right, what I will do is not wait too long, because it's important to realize that there's been quite a bit of research by Holt Lundstedt on this, and what she and her team has done is that they looked at 148 studies with over 300,000 participants, and I really sort of looked at where are the effect sizes the largest, which of these factors are the biggest contributors. So basically they did exactly the ranking task that I just asked you to do. And if you actually look at their outcomes, this is what they're saying. In order of least important to most important, least important is, for instance, not being exposed to air pollution. And then number 10 is taking appropriate medication. And you can see that with lower rankings, factors become more important. And perhaps interestingly, the 2 factors that are most important if I want to predict your mortality is on number 2, whether you receive enough social support, and number 1, whether you are socially integrated. So that's interesting. It is actually these social factors that seem to be most predictive of early mortality, not other factors such as whether you are obese, whether you exercise, whether you drink excessive amounts of alcohol, etc. Yeah? So, okay, this is an interesting sort of finding, and it alerts us to 2 things. The first one is that, interestingly, if it comes to being socially connected and having lots of social support, those are not the type of things that we typically find in all sorts of brochures when we go and visit our doctor. Right? So, for instance, this is just a leaflet that you can find distributed to all households in Queensland. What should you do to stay healthy? You can see lots of things on the list, but the 2 that I just mentioned are most important are not on it. Likewise, on the right-hand side, you can see what the Chief Medical Officer in the UK is saying what you need to do for better health. Well, you shouldn't smoke, you should have a balanced diet, be physically active, etc. But again, the 2 most important factors don't seem to be on it. So that's interesting. This is another issue that I would like to draw your attention to. We did some research, actually Alex Haslam led this research, where we had participants engage in their ranking exercise, the same one as you just did, asking people to rank how important social support, social integration, not smoking, etc. is. And they're ranked here in order of importance. So this is what people actually mentioned, and this is the true ranking. Right? Social support is most protective of early mortality. Air pollution is least important. So what you can see then, let's just focus on the factors that are actually not including social support, social integration. Then you can see that our participants did a rather reasonable job in predicting outcomes, right? So, for instance, not smoking, people said that that was very important. Well, it is very important, right? And for instance, for air pollution, they said that was least important. That's least important, according to these rankings by Holt Lundstedt. But the interesting thing is that as soon as you take the 2 most important factors into account, then you can see that that correlation between perceived rankings and true rankings becomes pretty poor and not a good indicator of mortality behaviors. So that's an interesting observation. People are generally not that great in ranking these behaviors, so they understand the benefits of physical health behaviors, but they don't recognize the benefits of social behaviors. Why is that the case? That's, of course, an obvious question. Well, on the one hand, you could say maybe it is because we've never been told by health professionals that being socially connected is so important for our health. So they're not on the type of lists that they give us with the type of behaviors that we need to do to stay healthy. Perhaps there's another reason, and perhaps that's more important. It is perhaps also because it is very hard to explain why such social factors are so important for health. If we want to understand why smoking is not good for us, well, it doesn't. It's obvious. People who smoke, they cough, their lungs, they look different from a person who doesn't smoke. So we can see it. With social factors that predict health, it's all a bit more complicated. Right? But it's also clear that given the importance of social support, that this is an unsatisfactory state of affairs. And this is basically where we've been doing a lot of work in the last couple of years, where we're trying to understand these processes. And our basic assumption here is very simple. What we need to understand is the very nature of human beings. It is all about, we all understand our place in the world by connecting to particular groups and knowing how we relate to other people in those groups. So because it is actually that we derive social identities from the groups that we belong to, that we can connect to other people, and we also then know how we can coordinate in a world of strangers. Those who are actually in our groups are not strangers, they're in-group members, and they help us to navigate our lives. And I want to talk a little bit more about the theoretical underpinnings of this idea. So social identity is the sense that we derive from being a member in a particular social group. A sense that it's not just about me or I, but what we actually derive from is an understanding that it's us and we. Yeah? And this is because social groups are so important in defining who we are, we often use social groups to describe who we are. And this is actually a very distinct state from personal identity. And social identity is not simply reducible to personal identity. In fact, it is often by understanding the groups that we belong to that we understand an individual's personal identity. So, for instance, for me, when I want to describe who I am as a unique individual, I often refer to the group memberships that I have. I will talk about living in Australia, my gender, the fact that I have a family, the sports that I do, the hobbies that I have, and all of those things describe who I as a unique individual am. Okay. So that's all sort of a bit technical, but over the last couple of years, we did see that that sense of usness is incredibly important to understand a whole range of processes. For instance, communication. If we want to understand effective communication, we need to understand whether we see that person communicating with us as someone like us. Someone is part of the same group as I am. The same goes for trust. If I actually trust with other people who belong to this is higher when we actually belong to the same groups. We feel a sense of social connection to other people that are part of our social identity. We also feel more solidarity with those people who belong to our group, are part of us. And it is because of that shared identity that we have that we actually accept the influence from people and we accept their leadership. We listen to particular people because we see them as part of the same group. And this is, of course, incredibly important in a time of COVID. When a leader tells you to stay at home, do you share identity with that person? I'll get back to that in a minute. So these processes are well understood now in the social identity literature. One of the things that is more recent development is that this also is incredibly important if we're trying to understand mental health. It is because communication, trust, all the things that because we actually share identity with other group members, that we also feel better. We have a sense of being in control. We have a sense of belonging. We feel that we're socially supported. That enhances coping, resilience. And it is by being with other people in our group and the influence that we accept from them that we have a greater sense of purpose and meaning. So from there, you can actually see that social identity, the sense that we're all in this together, has important implications for mental health. And I'll talk a bit more about that. So what I would like to do is just show you some studies that we've done over the last couple of years, and I focus on review studies that predict these hypotheses. One of them has been led by Tegan Pruis. Tegan is a clinical psychologist, and this is a bit dated, so there are more studies out there now, but she did a meta-analysis looking at 15 published studies that included a measure of social identification, to what extent people identified with a group that was central in the study, and asked them about clinical depression. So what all of these studies shows, these are the correlations, the effect sizes, is that for all of these studies, there was a negative relationship. So the more that people identified with the groups that they were asked about, the lower their depression. Across these 15 published studies, that correlation is minus 0.25. Yeah, it's not massive, but it's robust, as you can see. You typically find it in most studies. So what this suggests is that if people don't identify with the groups around them, then that can be associated with depression. There's another study that Tegan did that I think is important to mention here. She looked at the ELSA, the English Longitudinal Study of Aging, and she looked at the number of groups that her participants belonged to. All of these participants, this was a subset of participants out of a database of more than 4,000 people. So she identified 339 individuals who were clinically depressed at time 1. What she then sort of looked at is the number of people, the number of groups that they belong to at wave 3. So this is 4 years later. And then she again looked at wave 5, which is again 4 years later, at the number of people who were depressed, still depressed, who had relapsed. So, and then at the same time, she was controlling for a number of other variables that we know are relating to depression at wave 1. Yeah. So, just to summarize what she found that if people belonged to 0 groups, were depressed at time 1, they belonged to 0 groups at wave 3, then 4 years later, the chance that they were still depressed was 41%. If they belonged to 1 group, it was reduced to 31%. If they belonged to 2 groups at wave 3, then the chance that they were still depressed 4 years later was 21%. And you can see for 3 or more groups, it's only 15%. So what you see here, if you have a history of depression but join 2 groups, your risk of relapse 4 years later is half of what it would be if you were in no groups. Okay? There's one more study that I would just like to emphasize, or there are actually 2 more, sorry. Because the same issues, of course, play a role also in the workplace, as organizational psychologists know. So Nick Steffens did this study where he looked at lots of studies in the organizational field and looked simply at the correlation between social identification and work group identification in mental health. And that was positive. So the more that people identify with their work group, the better their mental health. Likewise, the more that people identify with their organization as a whole, the better their mental health. On the right-hand side, you can see the graphs. You can see that there are only a few outliers on the left, but most of the studies, the effect size is again positive on the right-hand side of that red line. Okay? So if you could say that workplaces that don't have that sense of us, they also associate it with greater mental health issues. This is the final study that I would just like to show you before talking more about COVID. Nick Steffens also led studies looking at retirement. Even though we may get a lot of positive group memberships while we're working, it also means that if you retire, that may be bad for your health, in particular if you were strongly connected with your work group. So what Nick looked at is again in that ELSA longitudinal survey, the English longitudinal survey for aging. He looked at 424 individuals who retired, and he followed them for 6 years. And there was a control group of 424 individuals who did not retire, but I won't go into that. The important thing here is that Nick showed that if in those 6 years following retirement, people lose 2 of the group memberships that they belong to pre-retirement, then their risk of death in the first 6 years of retirement was 12%. If they only lose 1 of the groups they belong to, that is reduced to 5.2%. If they keep the membership in the groups pre and post retirement, you can see that the risk of dying in the first 6 years of retirement is only 2%. If they actually gain a group membership, you can see that that's even reduced to below 1%, and even a bit more so when they gain 2 group memberships. Yeah. So also here, we do find very strong effects. If you lose 1 group membership when you retire, your risk of dying in the next 6 years is more than double what it would be if you lost none. Yeah. So just to sort of summarize this, in this work that we've done, we've been incredibly surprised by the size of the effects that we have. And this is beautifully summarized by Robert Putnam in his book, Bowling Alone. When he actually reviewed the literature, this is the conclusion that he drew. He says, well, as a rough rule of thumb, if you belong to no group but decide to join one, you cut your risk of dying over the next year and a half. So what does that mean? He gives an example. He says, if you smoke and belong to no groups, it's a toss-up statistically whether you should stop smoking or start joining. And this is important because, as he says later on, these findings are in some ways heartening. It's easier to join a group than to lose weight, exercise regularly, or quit smoking. And because, as we know, especially in the health profession, it's hard to change people's behavior, to let them go to a gym, but we haven't even explored yet the different ways in which we can actually motivate people to become more connected, less isolated, and what kind of effects that then also can have on their mental health. Okay, I would like to look just briefly at the other side of the coin. When we look at the importance of social connectedness, we can also look at the sort of important problematic situations that we actually encounter when there's a lack of connectiveness. So we know that social isolation can have devastating consequences on health and well-being. We know, for instance, in prison settings that solitary confinement is the ultimate punishment. Denying a person contact with others is often the most effective way to break down their resistance. We also know, like the story of Robinson Crusoe, that castaways experience similar sort of fates. If you are deprived of human contact for an extended period of time, it's extremely challenging, and that is the main obstacle that people face when they have to adjust to an uninhabited environment. We also know that people can be incredibly vulnerable when they are no longer to pursue an active social life, for instance, because of old age, which limits their mobility. And of course, now we can also add to that, we know that people are incredibly negatively affected when they have to self-isolate because of COVID restrictions. But just returning very quickly to this point, then the broader point I would like to make, so far at least, if we are talking about improving people's mental health, we're not focusing enough perhaps on the importance of belonging, of social connectedness, and how that is positively contributing to mental health, and that we can also use that if we want to design interventions to improve people's mental health. I just want to talk a little bit more about loneliness more generally. It's very clear that in today's world, loneliness is seen as a growing problem. These are just some of the data, Australian data. I'm sure that it will be rather similar in Brazil. This was a sample of 54,000 Australians who were seen as representative for the population. And it is quite shocking to see how many of those respondents identified loneliness as a key issue. Only half of the Australians say that they rarely or never feel lonely. And in particular, if you look at for whom loneliness is a problem, we see that it is young people. So it's only a minority of people who say that they rarely or never feel lonely. And it's also people on low incomes who feel more lonely, who feel more vulnerable, and have fewer ways to connect with others. Yeah? Okay, let me turn to COVID. That was a long introduction, but it basically showed you the importance of social connectedness for health. And this is basically what, in a lot of countries, under lockdown restrictions, is the very thing that we couldn't do. We could not connect with others. And you don't have to look very far to find lots of headlines that talk about the enormous mental health cost that this has had. And we're only now starting to map out how high that mental health cost is. Yeah, so I would just like to talk a little bit more about that and show you some of the data that we have. I would like to highlight that some of this was reported in the book that we recently did, Together Apart. I mentioned at the beginning. This book was written in May this year, or made available in May. It just appeared, but it is actually free for downloading via Amazon. So if you're interested, go and get your free copy there. And the basic message of our book is really that to really understand COVID and how to best respond to it, but also how to stay mentally healthy during COVID, we have to understand the dynamics of we, because it's not about me. It is about connecting with others, sense of solidarity to get through this massive threat. In our book, we report some of the data that we collected, and I would like to emphasize a little bit more on that. Very early in the pandemic, in April, May, we started collecting data in 11 countries: Australia, France, Germany, Italy, Thailand, China, the Netherlands, Spain, the United Kingdom, United States, and Indonesia. Unfortunately, not Brazil. For most countries, they were either in the middle of a lockdown or they were going towards a lockdown. That was the first wave. We asked the participants to what extent they agreed or disagreed with the idea that if you were to self-isolate, you would feel lonely. And the blue bars are young people, orange middle-aged, and then gray is 51, 64, and then we have 65 plus. You can see that, for instance, in Australia, you can see what I just mentioned, that it's the younger people who are most concerned about self-isolation and the fear that they would get lonely, less so for 65 year plus people. Yeah, for some people, countries we don't have yellow bars because they were not present in our sample. Yeah, but in general, you can see there is a trend that with older age, they're less worried about lockdown. Similar sort of figures for loneliness, to what extent people agree with the items. I'm worried that COVID-19 will increase the extent to which I will feel lonely. Here too, people are less concerned about that. We also looked at a clinical measure of distress. So for this particular scale, we asked people to indicate over the last 30 days, so that was already when COVID was prominent on everyone's mind, to what extent they felt nervous, hopeless, restless, or fidgety, so depressed that nothing could cheer me up, that everything was an effort, and that they felt worthless. So for our whole sample, you can see this is the distress score. It's relatively low, which is positive, and between countries, there's not all that much of a difference. But we do see more differences when we actually start to look within country at different ages. Yeah, so we do see again in Australia, the older people are, the less distressed they are. There had been over the last 30 days, but that's not true everywhere. In Germany, Indonesia, for instance, we see that 65 plus, they also report high levels of distress over the last 30 days. But the fundamental question is then, what predicts well-being? And this was interestingly because that starts to connect very much to the message that I tried to get across in the first half of this talk. Simply looking at correlations for a whole sample, we do find that higher distress is reported by people who feel less socially supported from others during COVID, who perceive lower levels of solidarity with others in their country to combat COVID-19, who are less trusting of a number of sources, including the government, their community, healthcare professionals, etc. So they don't feel connected, they don't identify with particular groups. And the lower they actually feel that community connection is during COVID-19. We also find higher distress for people who feel that they have less control over COVID-19. And control, again, comes from actually feeling that you have a sense of solidarity. Also, people feel worse when they perceive that COVID-19 is more of a threat. And also, these are strong correlations. Across our whole sample, we find that the more that people fear to be lonely during the lockdown, the lower their well-being, the higher their distress, but also the more that they actually fear being disconnected during COVID-19, the higher their distress. We'd like to focus on 3 countries that show, I think, quite nicely the developments there in how actually mental health maps onto developments in a particular country. So in Australia, the story is one where we collected data in wave 1, March. there were many cases, but at wave 2, the situation was largely under control. This is very different in the US. Our second sample, when we asked people in March, there was a high number of new cases. And those same people were approached in July when the situation in the US was not under control and there was a lot of social unrest. Likewise, in the UK, it's in March, there were a number of, in the middle of the first wave, but in June, for these same individuals, they found themselves, even though lockdown was being lifted, people were still were not quite happy about how the first wave of COVID was being handled. And I just thought to show you, in these 3 countries, Australia, the UK, and the US, that people, in Australia, for instance, over time, people felt that COVID-19 is more likely to bring us together. You see for these participants in the UK and the US, there's a reduction in the sense of solidarity over time. Or you can even look at the extent to which people feel that they trust their government to respond to COVID-19 in a way that manages the risks appropriately. In Australia, over time, there's an increase in trust, but that's not the case in the UK, and that's not the case in the US. Or to the question, I feel that my country is responding responsibly to COVID-19. You see in Australia that people gain that sense of trust. They feel that the country is behaving responsibly, but not so in the UK and the US. I feel COVID-19 is pulling us apart. Here we do find in Australia a reduction in that sentiment, but in the UK and the US there's no change over time. And likewise, looking at the extent to which my country is well placed to manage this type of pandemic, in Australia there's increased trust in this. In the UK and the US it goes down, or it stays the same over time. Or when it comes to COVID-19, I feel I have enough knowledge and information to help me deal with the situation. In Australia, people are more likely to agree with that. The same actually in the UK, but not so in the US. So you see different trajectories there, that Australia is, over time, there's a greater confidence, a greater sense of solidarity to cohesion, a sense of shared identity in being able to tackle this virus, and that actually translates into particular sort of worries. In Australia, people are less worried. Over time, the UK that's the same, but in the US we don't really find that. But certainly when it comes to the question, when it comes to COVID-19, I personally feel on top of the situation, and I think it is unlikely I will be infected. In Australia, participants over time are more likely to agree with that item. They feel they start to gain confidence in being able to get on top of the virus. Less so in the UK, and there's no evidence of that emerging in the US. So what we see here then is that these mental health outcomes, the sense of control, the sense of feeling that COVID is a threat, they map directly, they're actually different in different countries. And that often has to do with the extent to which people feel that the COVID crisis has been handled responsibly and well. Yeah? I just would like to say a few more words about this survey. Just looking particularly at Australians, we had 730 Australians, a representative sample from all over the country. We did see more generally here that those people who were chronically lonely, who were lonely before COVID, they were more worried about self-isolation, felt less in control, more overwhelmed, helpless, scared, at risk and they were more vulnerable. And interestingly, though, if it was all about behaviors to stay safe, we didn't see any age differences, but we did see that younger people were less trusting of the government's response to COVID. And just a few more things where we found strong age effects. I think they're interesting, and they might be a bit different in different countries. But in Australia, we did see that the younger the participants, the more they actually felt that the members of the groups to which they belonged panicked about COVID. They felt that there's not enough information available to help me deal with COVID. They felt that the COVID situation is out of control and I'm scared about what might happen. The younger they are, the more they fear the worst case scenario that other people who are close to me could die as a result of COVID-19. I feel that there's nothing I can do to help with the COVID-19 outbreak and the fear that COVID is pulling us apart. The younger the participants, the less they were likely to agree with statements that I trust my government to respond to COVID in a way that manages the risks appropriately. But they were also less trusting of the media. And also they felt that there was less high quality knowledge available to deal with COVID. Also, they didn't really feel that their family was responding responsibly to COVID-19. And the less they were thought that Australia was responding responsibly, and the more they actually feared that the less that they actually agreed that COVID might pose a significant risk to their own health. And that is, of course, understandable given that young people are less at risk of COVID, the aftermath of COVID effects. Okay, just finally, given that social connectedness seems to be so important in helping us to understand who feels well during this pandemic, but also that one of the biggest problems of the pandemic is that people's fear about loneliness and social isolation. It has been very hard to stay in touch with all the groups that people belong to. So just very quickly, this is a sort of an online tool that we've designed. It takes only 5 to 10 minutes. It works on all sorts of platforms on your computer or on your iPhone, where we simply ask people to go through this, and they're being asked to simply plan for the social connections that they would like to make in the time of COVID. So think about the people that you want to call this week. Think about, even though you're on lockdown, think about who you want to Zoom with, who you want to talk to. And the initial findings are rather promising in a sense that if we look at pre-intervention and post-intervention, that people at least have greater confidence that they can stay connected to others right now during this time of the pandemic. We also know from people that they found the activity helpful, and because it makes them think about the different ways in which they can stay connected. So that's the left top corner of the screen. Yeah? So how to actually connect with people so not to become isolated. We also did a follow-up 10 days after doing the Groups to Connect G2C activity. We did see on the right-hand side, it was also reported, 53% of users report that they actually did complete their social goals, the goals they set for themselves. 34% completed at least one of their social goals. And a lot of people feel good about achieving these goals. It's very small steps, but perhaps this could be a helpful tool to stay connected during a time of a pandemic. I would like to leave it here, and I would finally, I just would like to acknowledge that the work I presented here is, of course, not just my work, but also the work of my collaborators, mostly at the University of Queensland, Alex Haslam, Tegan Pruis, Sari Bentley, Kath Haslam, and I would also like to say Nick Steffens, who's unfortunately not in the photo. Thank you very much for giving me the opportunity to present to you, and I hope it was of some value to you. Thank you very much.
Olá, obrigado pela atenção. Reiterando que a fala da professora Jolanda Jetten não foi síncrona, não é online, então a gente não tem como responder as perguntas depois da fala da professora Jetten. Ela falou do gabinete dela na Universidade de Queensland, onde a professora Dalila, que vocês visualizam, e eu fizemos o último pós-doutorado, uma simpatia enorme. E ela ficou disponível no link para vocês, vai estar disponível nos vídeos e os grupos de pesquisa disponibilizaram os slides e o livro da professora Jetten para vocês. Acho que vai dar para acompanhar melhor numa segunda visualização, porque por questões técnicas a gente optou por não mostrar o slide junto com a fala da professora, porque ia diminuir muito o tamanho da imagem, e vocês poderão depois visualizar os slides. Eu recomendo que façam assim enquanto assistem a fala da professora, que mostrou algo que nós, a professora Dalila França e eu, e todos os pesquisadores do GPSAI e do NSEPR, tentamos mostrar, junto com todos os colegas que participaram, como convidados, a quem aproveito para agradecer novamente, colegas de vários lugares do mundo, e pesquisadores destacados em suas perspectivas específicas na psicologia social. Todas as falas nesse evento, ao longo dos 3 dias que tivemos, destacam a importância das relações interpessoais e intergrupais, ou seja, os níveis de análise da área da psicologia social. Como eles são fundamentais para entender desde fenômenos como preconceito, até fenômenos como liderança e saúde mental e saúde física. Então, acho que a fala da professora coroa, na minha maneira de entender, é a cereja do bolo de 3 dias bastante profícuos de discussão. E aqui na minha fala final, dizer que me sinto orgulhoso de ser pesquisador, me sinto muito orgulhoso de ser psicólogo social, me sinto muito orgulhoso de ser professor da Universidade Federal de Sergipe e de permanecer lutando pelo conhecimento num país que precisa muito do conhecimento, precisa mais do conhecimento científico do que a própria Austrália, do que a Inglaterra, do que Portugal e do que vários países que investem muito em pesquisa precisam. Nós precisamos muito do conhecimento para instaurar a cidadania, né? E nós vimos ao longo desses 3 dias que o conhecimento combate racismo, o conhecimento cria oportunidades, enfim, o conhecimento combate a exclusão. Então, assim, nessa minha fala final, só quero agradecer as pessoas que apareceram nas lives e que trouxeram informações, e agradecer aqueles que fizeram perguntas, colocações, ou simplesmente disseram bom dia e assistiram o nosso evento, interessados. Os nossos grupos, daqui a pouco a professora Dalila vai falar e a gente divulga os contatos dos nossos grupos. A gente tem muito interesse em que vocês se tornem parceiros desse projeto de pesquisa e intervenção sobre a exclusão social. Agradecer aos colegas que não apareceram, os membros do grupo, porque eles estavam lá cuidando das coisas técnicas para que tudo desse certo, e na minha avaliação, tudo deu muito certo. Tivemos um excelente evento e temos pessoas muito motivadas nos 2 grupos, o que também nos motiva a continuar pesquisando, a continuar produzindo conhecimento, com quase nenhum recurso financeiro, com poucas bolsas, com cortes de bolsas, mas vai passar, né? Vai passar e vai melhorar, e a gente vai estar aqui firme e forte no ano que vem, no próximo, no segundo Simples, que vai ser um desafio enorme, mas ainda vai ser melhor do que o primeiro. Então, assim, a minha palavra final é de obrigado. Obrigado pela atenção, obrigado pelo interesse, e vamos estreitar relações, como a professora Jolanda colocou, as ligações sociais e as conexões sociais são fundamentais para a gente construir não só saúde mental, mas para a gente construir uma sociedade nova e esses passos de difusão do conhecimento científico e aquilo que vocês, mestrandos, alunos do PIBIC, doutorandos, estão fazendo é que mantém a chama viva. É produzir conhecimento num país que precisa de muito conhecimento. E produzir, a gente sabe, com todas as dificuldades que a gente encontra. Então, pronto. Vou passar para a professora Dalila. Obrigadíssimo por tudo e até o próximo Simples, ano que vem.
Obrigada, Marcos. Obrigada a todos. Obrigada, Marcos, pelas últimas palavras, que foram, assim, muito importantes para mostrar a importância de tudo o que nós estamos fazendo, sobretudo para os nossos alunos que estão iniciando, né, a sua vida enquanto pesquisadores, enquanto profissionais que estão trabalhando nessa área, como a Ana Raquel falou pela manhã, que não existe, né, estudando fenômeno que não existe, mas que a gente vê muito bem o que é que ele faz, né? Então, eu queria complementar a fala do professor Marcos Eugênio, agradecendo, né, a todos, né? A gente está chegando ao final, né, do nosso Simpósio de Psicologia Social da Universidade Federal de Sergipe, e agora eu gostaria de deixar registrado aqui os nossos agradecimentos. Nós agradecemos à Universidade Federal de Sergipe, à UFES, que tem sempre apoiado os eventos realizados por nós e que tem sempre contribuído para que seja possível a construção de espaços de compartilhamento e trocas de conhecimento. Ao Departamento de Psicologia e ao Programa de Pós-Graduação em Psicologia da UFES, pelo apoio e pela participação dos colegas e das colegas professores e professoras neste evento. Aos nossos palestrantes que abrilhantaram as mesas aqui no nosso Simples, nos enriquecendo de conhecimentos e aprendizagens. Aos nossos participantes que abrilhantaram as mesas do Simples, nos enriquecendo de conhecimento e aprendizagem, trazendo perguntas para as nossas discussões, né? Aqui tem um agradecimento a mim, eu vou saltar, certo? Eu vou agradecer ao professor Marcos, coordenador do grupo de pesquisa Normas Sociais, Estereótipos e Preconceito e Racismo, e também organizador do Simples, né? Foi o mentor desse evento, e a todos e todos os membros da comissão organizadora. Vocês fizeram este evento acontecer, cada detalhe, cada cuidado, a atenção. A equipe organizadora está de parabéns e nós agradecemos a cada um de vocês. E aqui eu queria falar da equipe GPSAI, que faz parte, né, que está parte dessa comissão organizadora e que está aí nos bastidores. Muitos não foram vistos, né? Muitos estiveram presentes como coordenadores, monitores e como apareceram ainda como moderadores nas mesas, né? Então, foram mais evidenciados e outros não. Então, eu gostaria que fosse disponibilizado o slide para a gente ver as caras dos nossos membros, tá certo? Acho que pronto, aqui sou eu, né, que eu sou a coordenadora do grupo, do GPSAI, Grupo de Pesquisa em Socialização das Atitudes Intergrupais e Racismo, e também temos os nossos membros, a Amanda, a Bárbara Ribeiro, a Camila Aires, pode passar, o Israel Jairo, a Joana dos Santos, a Josiane Ferreira, o Calil Costa, a Lorena Leite, a Paloma Souza, a Patrícia Matos, a Rosélia Anjos, o Wellington Moreira Primo, o Sávio e a Yandra. E agora nós vamos falar da equipe do NSE-PR, que também estava aí nos bastidores. Todos eles contribuíram bastante aí na realização do nosso evento. Aí o Marcos Eugênio Oliveira Lima no centro. O Arnaldo Júnior, a Camila Araújo, o Charles Souza, a Clara Laís, a Sofia Rita, o Enio Rodrigues, o Elias Mascarenhas e o Diego Fonseca, certo?
Dalila, deixa eu completar, ela é tímida, não mandou a foto, ainda tem Raquel de Andrade, acho que Diego Góes está aqui, Raquel de Andrade, eu vou me esquecer de pessoas, mas alguns não mandaram foto, mas tem mais pessoas que também aproveitam.
Isabela e Ayara.
Exatamente,
fundamental. A Sofia Helena, já falei. Charles Vinícius, Diego Góes, Clara Andrade, Sofia Helena, Isabela e Ayara, Arnaldo Júnior, Laís e Arima.
Sim. Exatamente, perfeito.
Todos eles colaboraram com o seu trabalho aí, sem aparecer, tá certo? Nós agradecemos a todos e a todas. Este evento já está marcado na história. Melhor do que esse, só a segunda edição. Esperamos encontrar todos e todas vocês no segundo Simples. Até lá. Um grande abraço, pessoal, e muitíssimo obrigado.
Muito obrigado. Até o próximo.
Até o próximo.